Bismillah Rahman Rahim 5090 level biology chapter 11 syllabus 2023. This will be the first video on the chapter on transport in humans. First, let's look at an overview of the chapter. Now, first of all, we have to describe the circulatory system as a system of blood vessels and a pump and valves to ensure one-way flow of blood. Then, double circulation as a system in which blood passes through the heart twice for each complete circuit. Then understand that a double circulation provides a low pressure circulation to the lungs. Important this, low pressure circulation to the lungs and a high pressure to the rest of the body. Then we have to know the structure of the heart and identify the structures of the mammalian heart limited to the muscular wall, the septum, left and right ventricle, atria, atrioventricular and semilunar valves, and coronary arteries. Explain the relative thickness, describe the functioning of the heart, state that the blood is pumped away from the heart in arteries and returns to the heart in veins. State that the activity of the heart may be monitored by ECG, pulse rate, and listening to sounds of valves closing. Investigate and explain the effect of physical activity on heart rate. Describe coronary heart disease and describe the role of diet and exercise in reducing the risk of coronary heart disease. Now, the first thing to understand is the double circulation. Double circulation means, number one, there has to be a pump, and then there has to be blood vessels. So a pump and blood vessels are the two things we've got to understand. But basically, the heart has to be four-chambered. One, two, three, four-chambered heart. And then, this side, if you can see this side of the heart, all is the deoxygenated blood. So from the body, the deoxygenated blood is going to go to the right atrium, and then from here it's going to go to the lungs, and then from the lungs it's going to return here. You see here, it's going to return here to the left atrium, and then from the left atrium it's going to go to the whole body. So this is the double circulation is made possible by the complete division of the heart into separate left and right side. Basically, the wall which divides the heart into right and left sides, and the left side receives oxygenated blood from the lungs. The left side receives this oxygenated blood from the lungs and pumps it to the systemic circulation. So this is called the systemic system. Please remember from the word system, systemic. It's not systematic. Some of you write systematic circulation. That's wrong. And this is called pulmonary. Why it's called pulmonary? Pulmonary means lungs. Like a person, a doctor who treats lung diseases like asthma and lung cancer or other diseases like bronchitis is called a pulmonologist. So the left side receives the oxygenated blood from the lungs, pumps it to the systemic circulation, and the right side receives the deoxygenated blood from the body and pumps it to the lungs. Another diagram to show you the double circulation, which the blood passes through the heart twice on each circuit of the body. This means that the pressure can be increased again after the lungs to ensure faster delivery of materials to the tissues, because the mammals are active and also have to maintain body temperature. Then body, heart, lung, heart, body. Circulation to the lungs is the pulmonary circulation. Circulation to the body is the systemic circulation at a higher pressure than the pulmonary, avoiding damaging the delicate capillaries in the lungs. So the lungs need a low pressure circulation. The body needs a high pressure circulation. This is the need of the body. So double circulation means pulmonary and systemic circulation. Why am I showing you this diagram is because as a biology student, as a science student, you should be inquisitive that, okay, if we are a double circulation, then what is a single circulation? This is something which you should be inquisitive about. Is there somewhere, do we have a single circulation and a double, and then do we have somewhere a triple circulation? This is what should come to your mind immediately if you are a very inquisitive biology and a very excited and a keen biology student. Then you see in fish we have this. This is a single circulation. A is a single circulation. A is a single circulation in which we have a two-chambered heart only. And the blood passes from the heart to the gills and then to the body, and then it comes back to the heart. So the heart is only two chambers. The same blood goes to the gills and then comes back to the body and then goes back to the heart. So there's only a two-chambered heart. There'll only be a atrium and a ventricle. That's it. So the ventricle would be this one and the atria would be this one, which receives the blood from the body. While in a double circulation, what do you have? In a double circulation, this is what you have. You have a four-chambered heart. One, two, three, four-chambered heart. And one side is the venous circulation. This side is the venous circulation. So the venous blood from the body goes back to the heart and then it goes to the lungs and then it gets oxygenated and then the oxygenated blood comes here to the back to the left atrium and then it goes to the left ventricle and then it goes out and goes to the whole body. So this is the whole, this is why we call it a double circulation, because we have a four-chambered heart. So I just want you to compare it so that you should know what is a single circulation and what is a double circulation. May or may not be in the syllabus, but you must know it. First of all, we must understand that the heart has a right side and a left side. But how are you going to define this? How are you going to really find this out? Now, there's a very simple way. I always say is, just think this is your heart. Place your copy on yourself. So this is your right arm. This is your right side. And this is your left side. So first of all, get the right and the left right. So yes, get the right and the left right. That's an interesting sentence. So you get the right and the left side, and then you, of course, can go on from that. Now, there's so many diagrams of the heart which I was looking through, and then this is the one which I thought was the best, which I could choose. The first thing we've got to understand is that this is the septum. The septum is this wall in between, which is separating the whole heart into right and left side. So this is the right side, and this is your left side. I always say pick up the copy or pick up the page on which you are making this diagram and then put it on your own self, and which is your right and left. And then you have the heart is divided into four chambers. Now there is the right atrium, this is the right atrium, this is the right ventricle, and then the right atrium and the left atrium. So the left atrium and the right atrium. And then you have the right ventricle. So this would be the right ventricle. See the arrow? And then this is the left ventricle. So this is going to be the left ventricle. Now I'm going to clear all the ink and then you can all see it. So left atrium, left ventricle, right atrium, right ventricle, septum. You must be able to label all this. Then the right side receives blood from the vena cava. So this is the superior vena cava, which is bringing blood, deoxygenated blood to the right side. There is also an inferior vena cava which will also open up here, which has not been shown. So this will be the inferior vena cava. Now these are both the vessels which are veins. Veins bring blood back to the heart. So this is bringing the deoxygenated blood back to the heart. Then of course the blood will go into the right ventricle, and from the right ventricle now arises this vessel. And why is it immediately dividing into two? This is the pulmonary artery. Arteries carry blood away from the heart. A artery, A away from the heart. So this is how you remember it. Arteries carry blood away from the heart. So the pulmonary artery divides into two because there are two lungs, the right lung and the left lung. So the one will go to the right lung and one, so right pulmonary artery and left pulmonary artery. And then in the lungs, of course, it will be oxygenated. Now the blood is going to return through the pulmonary veins. And this is also a pulmonary vein. Please remember, there are actually four pulmonary veins. So the pulmonary veins will now bring blood to the left atrium. Pulmonary veins will bring blood to the left atrium. Please remember, pulmonary vein is bringing oxygenated blood. Oxygenated blood. So now the blood is going to enter the left atrium. From the left atrium, it is going to enter the left ventricle. And then out comes the biggest artery of the body, which forms this arch. There's this arch. This is called the aortic arch. And then the aorta will carry blood. It will go down and will give off blood vessels to all the different parts of the body. It will give up these vessels as well. You can see these going up to the neck and the head. All these vessels will be going out. So I'll just clear all the ink so that you can see all of this very clearly. So pulmonary arteries carrying blood to the lungs, pulmonary arteries carrying blood to the lungs, pulmonary veins bringing blood back. So this is a pulmonary vein, this is also the pulmonary vein. Now another thing which you must see is the wall of the atria. Now you can see the wall of the atrium is not very thick, it's thin. This is the wall of the atria. But the wall of the left ventricle is even thicker. This is the wall of the left ventricle. This is very thick, but this is thin. So the left ventricle wall is very thick. I would say it is thicker. Why? Because it has to exert more force on the blood to pump it so that it reaches the entire body, and it has to go very far off. Like when you're standing, it has to go to your legs and then it has to return back to the heart. Another diagram showing you the details of the heart, and now we come to the important valves which are present in it, and I want you to talk about them. So the ones which are here at the base of the aorta and the base of the pulmonary artery, these ones are called the semilunar valves. So we call it also the aortic valve, which is at the base of the aorta, because this is the aorta. So it is at the base of the aorta, so this would be the semilunar valve. And there's another one which is at the base of the pulmonary artery here, which is also called the pulmonary valve, and this is this one here. So the pulmonary valve and the aortic valve, these are semilunar valves, half moon. Semi means half and lunar means moon, so semilunar valves, right? And then we have the atrioventricular valves. Atrioventricular means the ones which is between the atria and the ventricles. And I want to use a green color for that. So there is one on this side which will be called the tricuspid valve. So the right side is the tricuspid valve, and on the left side is this one, and this is called the mitral valve, but we don't call it mitral anymore. This is an old name. We call it the bicuspid valve. I tell you to remember it LB. I don't say LBW because then you remember cricket, leg before wicket. So left side is bicuspid and V for valve, not W for valve. So left side bicuspid valve. But you can remember it with LBW because I am sure we'll all get great cricket fans. So left side bicuspid valve, right side tricuspid valve. And the semilunar valves at the base of the aorta and the pulmonary artery. So it is only from the major two arteries which are leaving the heart. Pulmonary artery and the aorta are the two major arteries which are leaving the heart. The semilunar valves are at the base of those arteries. Now coming to the fact that the heart allows the flow of blood in one direction because of the valves. Now this is something that we need to understand. So I'm trying to go very slow and trying to help you all to understand. So vena cava is bringing blood to the right atrium. Right atrium fills up with blood. This valve opens. Which valve is this? Tricuspid valve. Blood flows into the right ventricle. You see, another thing which you've got to understand, that muscles in the wall of the atrium contract, and that pushes the blood into the right ventricle. Now, as soon as the right ventricle is full, Now these valves will close. The tricuspid valves will close. Now the muscle in the wall of the right ventricle will contract and blood will be pumped. Semilunar valve will open and blood will enter the pulmonary artery and will go into the right and the left pulmonary artery. Once again, let's be clear about this, is that the blood, which is the deoxygenated blood, is returning to the from the body, from the superior and the inferior vena cava. They open into the right atrium. Right atrium contracts, tricuspid valve opens, blood is pumped into the right ventricle. Then the tricuspid valve closes, muscles in the wall of the right ventricle contract, and the blood is pumped into the pulmonary artery, but then the semilunar valve has to open. So the blood will go into the pulmonary artery, which will go to the right and the left side to the two lungs, the right and the left lung. Now, once it returns, now what is going to happen? Now we're going to have the oxygenated blood entering through the pulmonary veins. These are the pulmonary veins I told you. And that's why we have four openings here. So four vessels opening, and these are the four pulmonary veins which open into the left atrium. Now the left atrium, we have the bicuspid valves, they open, blood flows into the left ventricle. Left atrium, left ventricle. Then the valves close and the blood is pumped into the aorta. Semilunar valve here will open. So semilunar valve at the base of the aorta will open and blood will flow into the aorta and then will reach the rest of the body. Of course, these vessels will arise from it. It's the biggest artery of the body. And all the arteries, except the pulmonary arteries, arise from the aorta. The aorta then goes down into the abdominal cavity and then it divides into the two legs. Now, the next topic is how can we monitor the activity of the heart? And the three prescribed ones in your syllabus are number one, ECG, number two, how to measure your pulse rate, and number three is listening to sounds of the valves closing. Now, you can see this is a normal ECG. And this is a fast heartbeat. You see, this is one cardiac activity, the P wave, the QRS, and the T wave. And you can see what is causing this. The P wave is the electrical circuit in the atria. Then the QRS complex tells us about what's happening in the ventricles. And then the T wave tells us how the heart is going to contract at this part of the cardiac cycle. Now, a normal heartbeat should be like this. You can see these waves coming again and again. And this is all comes on a graph paper. And this would be a faster heartbeat. This would be a very slow heartbeat. And this would be an irregular heartbeat. So you must know what is an ECG. It's actually a tracing of the electrical circuiting of the heart, the electrical activity of the heart more so. Then the next one that we have to talk about is, again, I've shown you another ECG, and it's a very low cost procedure. So it tells us a lot about the heart, and that is a very good way of seeing the condition of the heart of a patient. Then a method which is called auscultation is a method used to listen to sounds of the body during a physical examination. And for that we use a stethoscope. And we place the stethoscope at different places, at different points on the chest, and then we can see if the aortic component of the second heart sound, is that correct? Is the pulmonary artery component of the second heart sound correct? Is the bicuspid component of the first heart sound correct? Is the tricuspid component correct? And what we use a stethoscope. So by placing it at different places on the chest, we can then see if the valves are closing or they are not closing correctly. Is there some sort of a defect in the valves, or there isn't any defect? Then we come to the pulse rate. Now the pulse rate, why is it felt on the wrist? Because we have the radial artery which passes on top of a bone there. So it is superficial, so we can then measure the rate of the heart. Now you can see here is a diagram of how to check your own pulse. Number one, find an area of the palm near the thumb, raise the index and middle fingers together, place both fingers on the middle wrist, feel around for the throbbing, and then count number of beats for 15 seconds and multiply by 4. So this is a very easy way to check your own pulse, and everybody should do this and everybody should know how to do this. Now there are also 7 other parts of the body where you can actually check your pulse, where the artery is very superficial, and one is in your neck, and one of course is the one which I've talked about in the wrist, but you can look up, you can Google the rest and see where are the other parts of the body where you can also check the pulse. Also, we can use a machine which is called an oximeter, in which we can just put it on the thumb. It's got batteries in it and can measure your pulse. We've of course all been using it during the COVID times and checking pulse rates and the oxygen concentrations, which of course fall down when you have COVID because of the lung issues that you develop. Now coming to the topic of coronary heart disease. Now what is coronary heart disease? Is a blockage of the coronary arteries. Now what are the coronary arteries? They actually arise from the aorta. You can see this is the aortic arch. So they arise from the aorta, and there is the right coronary artery and the left coronary artery, and then it supplies the muscle in the wall of the heart. You see, the wall of the heart also is made up of muscle. It's a very special muscle called the myocardium, which keeps on working from the day you were born till the day you die, which you live for. If you live for 80 years, but it was not never stopped working. So the left and the right coronary arteries, of course, then divide into further branches, and if any of these gets blocked, if any of these gets blocked, then we have problems, because a certain portion of the heart muscle will not receive oxygen, and if it does not receive glucose and oxygen, well, that portion of the heart muscle is going to die. Now you can see what happens. You see there is a deposition in the wall. There's a fat deposition which is called a plaque. So this is the area which we are showing this, and this is the details of it, which you see the fat deposition in the wall of the artery. You can see here another diagram in which the coronary artery is blocked, and you can see the fat deposition, and then of course, because it becomes a rough area, so at times the blood can clot there, and this of course would result in a full blockage. Then another diagram here to show you the right and the left coronary arteries. I don't expect you to know the names. These are of course a lot of very detailed names, but you can see how it is arising from the aorta. This is the aorta, which you have to understand, the arch of the aorta. That's a very typical arch of the aorta, which everybody we as a medical student would always pick it up. So the aorta, the aortic arteries, if they get blocked, then we have a problem. And if say there's a blockage here, then this part of the heart muscle is going to be deprived of glucose and oxygen. So this part of the heart muscle will die. Now the heart muscle has to work as a whole. First the atria contract, then the ventricles contract. So it's a very rhythmic beating of the heart. Now that will not be possible. Of course, the person has severe pain and we say he has a heart attack, and sometimes they survive, sometimes they don't survive. Now, what are the possible risk factors? There are about 7 which have been listed in your syllabus. Number 1 is stress. Stress causes the release of a hormone called adrenaline, and adrenaline results in vasoconstriction, and that results in higher blood pressures and more chances of fat being deposited in the wall of the arteries. Then sedentary lifestyle, which we are all doing these days. We're all sitting on our phones and our laptops. We don't do any exercise. So that is another one which is going to predispose to heart conditions. Then smoking, all those people who smoke, we know there's tar, there's nicotine. Nicotine causes vasoconstriction. All those factors are going to increase the risks of a person having a heart attack. Then age, certain age groups are more prone. Than diet. Diet is more saturated fats. Saturated fats are more the animal fats. Animal fats means like butter, cheese, fat on the meat. So animal fats. And then gender, men are more prone to heart attacks than women, I guess because of the hormones, there's difference in hormones. And then of course we have the most important is a genetic predisposition. Some people in their families, they've had people having heart attacks at a very young age, and we find that there is some genetic predisposition, meaning that their genes favor the risk of a heart attack. Of course, more studies have to be done on that to really find out what is the actual genetic factor which is going to predispose to the person getting a heart problem or a coronary heart disease. Now, the last topic in this video is reducing the risk of coronary heart disease. We know that diets, so less saturated fats, that means less desi ghee parathas, less saturated fats, less ghee, less butter in your diet, more healthy foods like vegetables and fruit. So less saturated fats. Exercise, by exercise we mean physical exercise, like people go to the gym or you're on the treadmill or you walk every day for half an hour. All these factors we feel reduce the risk of heart disease. So all these factors have been promoted, and those people, those areas, those where food and diet is mainly more vegetable oils, then those places are less prone to people. So the studies have been done on the Mediterranean area where olive oil is used, where people have lesser heart disease. And exercise, of course, regular exercise. I don't mean just once in a month or once in a year, but regular exercise daily, 5 days a week, would help you in reducing the risk of coronary heart disease. So this finishes this video one, which was covering the first and the second topics, which I have just mentioned in the beginning. And we will continue the rest in the next video. Thank you very much. Thank you for watching and thank you for subscribing. We have completed 11.1 and 11.2 of this chapter, and this is video 1. The rest will continue in the video 2, the rest of this chapter, which is 11.3 and 11.4. And please, thank you for subscribing and thank you for all the comments and thank you for all the likes. I'm very grateful to all of you who watch my channel and who give me a very positive feedback. And of course, I also welcome the negative feedback, but I don't like it very much. But it's okay, it's part of life, the positive and the negatives. So thank you very much. Thank you for watching the channel and thank you for liking it. Thank you very much.